Hello everyone, my name is Kayla and I am a registered dietitian nutritionist at San Antonio Regional Hospital. Nutrition is an important aspect of cancer prevention and cancer treatment. In this video, we will be discussing how nutrition can help you feel better and stay stronger before, during, and after cancer treatment. After cancer diagnosis, unless otherwise advised and if you can, all cancer survivors are advised to follow the cancer prevention recommendations as far as possible after the acute stage of treatment. Most of the information from this presentation includes recommendations from the American Cancer Society and the American Institute for Cancer Research. Studies continue to suggest that a diet rich in fruits, vegetables, whole grains, and legumes, while being low in red meats, processed meats, saturated fats, and added sugars, can help reduce the risk of cancer. The American Cancer Society states that studies have provided consistent and compelling evidence that a healthy dietary pattern, which focuses mainly on plant foods, are linked with lower risk of cancer, certain other diseases, and dying at a younger age. Researchers have known for some time that eating a healthful diet provides vitamins, minerals, and protective plant substances that help defend the body against cancer. By maintaining a good nutritional status, especially during cancer treatment, you will help your body maintain its strength and energy to help lower the risk of infection, heal and recover faster, and ultimately feel better. Macronutrients provide calories and are required to maintain body functions. We will discuss fats, carbohydrates, and proteins. Fats are a good source of energy for our bodies and are important for insulating body tissues, helping to transport fat-soluble vitamins throughout the body, and some fats are stored for energy. Some fats are healthier for our bodies than others. Try to choose unsaturated fats such as those found in vegetable oils like olive oil, nuts, seeds, and fish. Carbohydrates, or carbs for short, are our body's main source of energy. The healthiest sources of carbohydrates are found in fruits, vegetables, and whole grains. These foods contain fiber, which is the part of the plant food we cannot digest. Insoluble fiber bulks our stool and acts like a broom, removing waste from our bodies, while soluble fiber binds to water to help soften stools. Protein is important for growth, repairing body tissues, and maintaining a healthy immune system. People with cancer often require extra protein to help fight infection and for healing. Try to choose lean sources of protein such as lean meats, eggs, and tofu, beans, and nuts are also good sources of protein, especially for vegetarians. Maintaining good hydration status is very important because our bodies are made mostly of water. Water helps us maintain our fluid and electrolyte balance. It is important to stay hydrated even if you're not feeling thirsty. Every body is unique and has special fluid requirements depending on activity status, metabolism, and the temperature outside. Not enough water may lead to dehydration and constipation. A good way to monitor hydration status is by checking the color of your urine. If your urine is the color of apple juice, you may need to increase your intake of fluid. The goal is pale yellow urine, closer to the color of lemonade. Our bodies need vitamins and minerals to help the body function properly and maintain our metabolism, which helps us utilize the energy in food. If you are eating a balanced diet and consuming enough calories and protein, then you are likely taking in enough vitamins and minerals. However, if your intake has been poor due to side effects of cancer treatment, your doctor may recommend a multivitamin. If your oncologist recommends taking a multivitamin, look for one that does not exceed the daily value and ask your doctor if he or she wants you on a multivitamin with or without iron. Iron can cause constipation, and depending on the cause of a person's anemia, iron supplements may not be effective. If you are thinking about taking a vitamin or mineral supplement, please always check with your doctor. Large doses of some vitamins and minerals can reduce the efficacy of chemotherapy and radiation therapies. Antioxidants are compounds found in food that help prevent tissues and cells in the body from oxidation. You can think of it as wear and tear. Studies suggest that people who eat more vegetables and fruits, which are rich sources of antioxidants, may have a lower risk for some types of cancer. But this does not necessarily mean that it is the antioxidants that are responsible for this, as these foods also contain many other components. Some of these compounds are called phytochemicals. Phyto is the Greek translation for plants, which have the potential to stimulate the immune system, slow the growth rate of cancer cells, and prevent DNA damage that can lead to cancer. The best way to obtain antioxidants and phytochemicals is through eating plant foods that contain them instead of taking supplements. The National Cancer Institute recommends eating at least 5 servings of fruits and vegetables per day. These foods boost your intake of phytochemicals, fiber, and immunity-boosting antioxidants. The American Cancer Society recommends a well-balanced, plant-based diet. This means choosing a diet with emphasis on plant foods. An appropriate portion of meats are the size and thickness of the palm of your hand. Per the American Institute for Cancer Research, limit red meat to a maximum of 3 servings per week, which is about 12 to 18 ounces of cooked red meat total per week. Red meat promotes inflammation in human tissue. Consume little, if any, processed meat because these often contain added nitrates and preservatives. If you do choose to eat animal proteins, choose leaner proteins such as fish and poultry with the skin removed, and appropriate portion sizes. Choose lower temperature cooking methods which will reduce the amount of heterocyclic amines, or HCA, which can be carcinogenic when we consume them in high enough concentrations. The National Cancer Institute states that HCAs formed by cooking meat at high temperatures have been found to be mutagenic. That is, they cause changes in DNA that may increase the risk of cancer. Try plant-based protein options, even if you start with having one meatless meal per week, such as Meatless Monday. Try new recipes and get creative by substituting a plant-based option in recipes, such as replacing half the meat with beans in a chili recipe. For cancer risk reduction, the American Cancer Society advises following the United States Dietary Guidelines, which is to consume at least 2.5 to 3 cups of vegetables per day and 1.5 to 2 cups of fruit each day. Try to choose whole fruit or vegetables instead of juice to get more fiber. If you do choose juice, choose 100% juice and avoid those with added sugars. Studies are showing that higher vegetable and fruit intake reduces cancer risk have led researchers to try to figure out which specific nutrients from these foods are responsible. But many studies have not found that supplements containing a certain nutrient, like vitamins, to reduce cancer risk. As we mentioned earlier, you can't replace eating fruits and vegetables with taking a pill due to phytochemicals and their synergetic effect with foods. This is why it's important to try to eat a variety of fruits and vegetables of different colors to obtain a variety of vitamins, minerals, and phytochemicals. Again, the goal is to meet nutritional needs through diet alone. For the most part, research does not support using supplements in lowering cancer risk, and high-dose dietary supplements are not recommended for cancer prevention. Limit consumption of processed foods high in fat, starches, or sugars, including fast foods, packaged foods, snacks, bakery items, desserts, and candy. Limiting these foods helps to control calorie intake, which helps to maintain a healthy weight. Instead, choose whole grain breads, pastas, and cereals to increase fiber and naturally occurring nutrients found in whole grains. By increasing consumption of fruits, vegetables, and whole grains, you will subsequently increase the intake of fiber. Fiber helps us feel fuller longer and assists with slowing digestion to prevent blood sugar spikes. As we discussed before, fiber also helps reduce constipation and therefore improves transit time for removing waste from the body. Aim for at least 30 grams of fiber per day to promote a healthy digestive system and reduce risk of colon cancer. Aim for getting most of your fat from plant-based sources which contain monounsaturated fats such as olives and nuts. Polyunsaturated fats, such as omega-3 fatty acids, help reduce inflammation. They are found in fatty fish such as salmon and mackerel, and also in plant foods such as walnuts, flax seeds, and chia seeds. Healthy fats are a dense source of calories, so they should be limited in those wishing to maintain a healthy weight. They could also be a good option for those of us who are trying to gain weight, but are unable to consume large portions of foods. Limit intake of saturated fats, which come from animal foods such as full-fat dairy, meat, poultry, coconut, and palm kernel oils. These fats can raise cholesterol and therefore increase risk of heart disease. Lastly, trans fats are man-made fats formed when vegetable oils are processed into solids and were previously used in margarine and shortening. You can identify trans fats by looking at the ingredient lists on products that say partially hydrogenated or hydrogenated. These can lower good cholesterol and raise bad cholesterol. Trans fats have been banned in the United States food supply since 2018. Sugar-sweetened drinks are defined as liquids that are sweetened by adding free sugars such as sucrose, high-fructose corn syrup, or sugars naturally present in honey, syrups, fruit juices, and fruit juice concentrate. This includes, among others, sodas, sports drinks, energy drinks, sweetened waters, coffee, and tea-based beverages with sugars and syrups added. This does not include versions of these drinks which are sugar-free or sweetened only with artificial sweeteners. In general, our diets have too much added sugar. Excess sugar is generally not good for us because it provides excess calories and may displace food and calories from nutrient-dense foods. Patients often ask if sugar makes cancer worse. According to the National Cancer Institute, quote, research has shown that cancer cells consume more sugar, glucose, than normal cells, but no studies have shown that eating sugar will make your cancer worse or that if you stop eating sugar, your cancer will shrink or disappear. However, a high sugar diet may contribute to excess weight gain, which is associated with an increased risk of developing several types of cancer. End quote. More research is needed to understand the relationship between cancer and sugar intake. Therefore, aim to maintain hydration by drinking mostly water and unsweetened beverages, unless you are otherwise advised by your medical team. Noticing the food label on packaged foods can help us make informed decisions about the foods we choose. As we discussed earlier, limit saturated fat, trans fats, sodium, and added sugars. Be aware of advertising and claims on food labels. For example, organic donuts may be made with organic flour, sugar, and butter and fried in organic oil, but they are still donuts and should be enjoyed in moderation. Choose nutrient-dense foods such as vegetables, fruits, whole grains instead of junk foods such as French fries, chips, and desserts. A treat food is no longer a treat when you eat it every day. Some simple tips for dining out include requesting sauces and dressings on the side, filling up on vegetables such as starting with a side salad. Avoid eating large portion sizes by sharing with a friend or packing away leftovers for another meal. I have included this plate from the Gasol Foundation because it summarizes all the aspects of a healthy lifestyle, including being active, eating healthy, and also the importance of maintaining adequate hydration, sleeping well, and the emotional aspect of cancer therapy. Aim to make about half your plate fruits and vegetables, with a larger portion coming from non-starchy vegetables. By choosing just one serving of fruits and one serving of vegetables at each meal, you will already check off 6 servings of fruits and vegetables for the day. Remember to choose whole grains more often and try to reduce red meat intake to less than 3 servings per week. There is also a reminder to choose healthier oils when cooking. When it comes to nutrition, even small changes can make a big difference. Remember, balance, variety, and moderation in your dietary choices. Lastly, let's briefly discuss alcohol. If you are currently undergoing cancer treatments, check with your oncology team to make sure it is okay to consume alcohol. Research shows that drinking alcohol can increase your risk of cancer of the mouth, throat, esophagus, larynx or voice box, liver, and breast. The more you drink, the higher your risk. Additionally, the risk of cancer is much higher for those who drink alcohol and also use tobacco. The recommendation for alcohol is for men to have 2 drinks or less per day, while women should have 1 or less drinks per day. The amounts of each beverage that counts as a standard drink is shown above. It has been suggested that certain substances in red wine, such as resveratrol, have anti-cancer properties. However, there is no evidence that drinking red wine reduces the risk of cancer. Studies have found a link between resveratrol and lower risk of inflammation and blood clotting, but there is no definitive evidence that it reduces risk of heart disease. Therefore, if you are not drinking red wine already, do not start. It is important to consider the amount of alcohol consumed, not the type of alcoholic drink. The more alcohol you consume, the higher the risk. In summary, a large part of our well-being is tied into the synergistic effect of the foods we eat. Following a healthy diet means choosing healthful foods most of the time and taking steps to improve the quality of our diet by not overdoing it on one type of food. It is the sum of our decisions. Eating well and maintaining an active lifestyle will in turn help us maintain a healthy weight and promote wellness.